Next speaker is from Ontario. Ontario has a long-standing Immunization of School Pupils Act, and Dr. Vanita Dubey is a medical health officer at Toronto Public Health. And she's also a member of the National Advisory Committee on Immunization and also works as an emergency medicine physician outside of the Greater Toronto area. She's got an appointment at the University of Toronto's Dalla Lana School of Public Health. And her presentation today is going to be about Ontario's experience with implementing mandatory education for parents seeking a philosophical exemption. Do we have?
Hi there.
Great, Vanita, you're on. Fantastic.
For some reason, my video is not working, but all the better for you so you can't see my dirty office. I apologize that I can't make it in person. When I decided a few weeks ago, I was worried that COVID-19 was going to accelerate. At that time, Toronto Public Health had 2 cases, and now we're sitting at 11. So it's been a very busy week, and I'm very pleased to be able to present this with you, but am sorry that I can't make it. But this was a good decision. So let's get started. I'm going to share with you Toronto Public Health's experience with our provincial legislation, and in particular, the mandatory education session that has been new in the past couple of years. So next slide, please. Okay, so for some reason, okay, yeah, thank you. So this is an outline, and we'll just get going. Next slide, please. Talking about the Immunization of School Pupils Act. So just next slide, please. Sorry, going back one. The Immunization School Pupils Act is Ontario-specific legislation, and the aim of the legislation is to protect the health of children against certain diseases. And they're called designated diseases. So you can see the diseases that are listed there: diphtheria, tetanus, polio, pertussis, measles, mumps, rubella, meningococcal disease, and varicella. Essentially, it's the routine childhood vaccinations. Next slide, please. In the Act, parents are required to either have their child vaccinated or according to the prescribed immunization schedule, which is detailed in the Act and which essentially follows our publicly funded schedule, or to have a valid exemption. It is not a mandatory vaccination policy. You either get vaccinated or have a valid exemption. Next slide, please. So the reason, and if you do not meet the requirements of the legislation, you could receive one of these orders from Toronto Public Health. This is an order for suspension. And so the way we administer the process is over a 9-week period, you'll receive letter 1, which states your child it's sent to the parent. Your child is due for a vaccine that protects against the following diseases. If after 3 weeks we haven't received the information, you get a letter 2. After another 3 weeks, you'll get a suspension order, which is this in the mail, which states the date in which the suspension would occur if you do not meet the requirements of the Act. Next slide, please. So the 2 exemptions that you can have are, one is the medical exemption, and the medical reasons are truly first of all, the exemption form must be completed by a physician or a nurse and submitted to the public health department. And it's either you have proof of immunity, like I had chickenpox, and the physician can verify your immunity, or you have a medical contraindication to vaccination. It's not for other types of medical reasons that are not well documented as contraindications. Next slide, please. So let's talk about the philosophical and religious exemption. Next slide, please. So the philosophical and religious exemptions, let me take you through the process, and I'm going to show you what the form looks like. So in September 2018, we had a mandatory education session that was added to the Act. And so the process now goes like this, where previously you just had to complete the form, get it notarized, and send it in. Now the parent actually has to come to the local public health department and complete a session where they watch a standard ministry developed video that's about 30 minutes. Typically in Toronto Public Health, we try and do these as very large sessions, 100 people at a session, but we do accommodate individual and small group sessions. So the parent then gets a certificate that they've completed this session. They then have to complete the exemption form, which I'm going to show you in a minute. And then they have to get it notarized. They have to get it notarized after they watch the video. And then they submit the form in the original, the certificate in a copy. I just put those details in to tell you that it is a complicated process. And then they can get an exemption for their child or their children. Next slide, please. So this is the front page of the philosophical, it's called a statement of conscience or religious belief form. You don't tick whether you're getting an exemption for a philosophical reason or a religious belief. It's all the same form. And so you can see there's some demographic details that we collect. It states the process for getting the exemption. And then there's a box there on the bottom that says reasons for not being vaccinated. And we're going to come back to that box. That was newly added to the form in the past couple of years. And we'll come back to that later on in the presentation. Next slide, please. This is the back side of the form, and a parent has to sign stating which diseases in particular they want to be exempt, they want their child to be exempt from, and then they have to sign it, and then they have to get it notarized. But again, it says on the other side, you must first complete the video. And so sometimes we have parents coming to our sessions who have a notarized copy of the form, which we do not accept because they have to first have completed the video before they can get the form completed and notarized. Next slide, please. So how much work is this? And I put this in there for you because I know that BC is, as we heard in the morning earlier, that, you're rolling out your own type of system. If for a health department like Toronto Public Health, where we have 350,000 students each school year, that's how many immunization records we try to assess. It's from public and private schools, though right now we have good mechanisms in place for public school assessments, less so for private school assessments. And overall, actually, we have good vaccination rates, and our exemption rates are 1.7%, for example. So in Toronto, it's less than 5,000 students have a philosophical or religious exemption to the MMR vaccine. Next slide, please. So now I'm going to talk to you about the survey findings of parents who attended this education session. Next slide, please. So we did a survey of the parents who came to the education session. In the beginning, the reason why we had a survey was actually parents were quite upset that they had to actually come in person. They didn't like the video, some of them. They wanted to provide us with feedback. And so the survey was one way in which we said, complete the survey and we will roll the answers up and be able to provide your feedback to the Ministry of Health. So you'll see we've handed out in the last 2 years, 2 school years, 1,525 certificates, and more in the second year than in the first year. And at the end of these last 2 years, 479 parents completed the survey, which is a response rate of about 30%. And there were also some open text responses that we analyzed and grouped into themes, which I'll go over as well. Next slide, please. So we wanted to determine how satisfied parents were with attending this session, something that was mandatory for them to attend if they wanted one of these exemptions. And the first point on the education session was provided in a respectful manner. This was one indicator that we actually wanted to do very well in, because we wanted the parents to at least feel like they were being respected. And so 82% of parents agreed with that. About half of the parents, 55%, said they were satisfied with the interaction that they had with health unit staff. 41% said that the video, this ministry video, provided enough information to help them make a decision about their child's immunization. And even less, only 27% felt that their questions were answered at the session. And about a quarter of parents felt that they learned something new about immunization from the education session. Next slide, please. Why were parents coming to seek an exemption? And we thought that this was sort of a pulse on vaccine hesitancy for why people are choosing not to vaccinate their children in the now. And you'll see that the reasons why people were seeking an exemption were reasons we know people are vaccine hesitant and choosing not to vaccinate. 58% said they were worried about side effects. Another 58% said they were worried about ingredients. Now, they could pick more than one answer. 27% felt it was because of their religious beliefs. 18% felt they weren't sure if the vaccines worked. 13% said they didn't have enough information about vaccines, which meant that almost 90% felt that they had enough information. 11% felt that they didn't think their child was at risk of getting sick from the disease the vaccine prevented against. And only 1%, only 5 parents who completed the survey said that they weren't completing an exemption, so they were there for other reasons. Next slide, please. So how many of these parents actually are getting an exemption because they have other children in the system, and maybe they have children who are now joining the system and the rules have changed and they're getting an exemption for the second time? Only about a third of them. 2/3 were getting an exemption for the very first time. Next slide, please. So this is as close to kind of a before and after based on participants' self-reflection on their feelings about immunization prior to the education session and after the education session. And what you'll see here, we'll go through the numbers don't change very much, though the direction is favorable. I don't know if you would call it that because the numbers really don't change. But essentially, prior to the education session, 69% of parents were somewhat or very opposed to immunizations. And after the education session, now it's only 67%. So we've moved 2% on that. 16% were undecided about immunizations before they came to the education session. And after the education session, 14% were still undecided. Meanwhile, 10% who came to the session were somewhat or very supportive. And these are probably people who are coming because maybe they don't want to give their child varicella vaccine. They can't prove, maybe their child had chickenpox. They can't prove their child had chickenpox. And so the only way for them to meet the requirements of the ISP is to get a philosophical or religious exemption. So these are parents who are somewhat or very supportive, 10% beforehand. And afterwards, now we have 13% who were somewhat or very supportive of immunizations. Next slide, please. And so after the education session, how many of them intended to proceed with obtaining an exemption after completing the education session? And so this is kind of the real, does this intervention work to really change a parent's mind and convince them not to get an exemption? So you'll see that 81% decided that they were still going to go ahead and seek an exemption. 6% said no, they don't plan to seek an exemption. It's probably really 5% because we know from previously 1% previously had said that they were not planning to get an exemption to begin with. But 9% are unsure and 4% said they did not answer the question. So it's hard to know whether there was really an impact here. If you're looking at a definitive impact, it might just be about 5 or 6%. Next slide, please. I'm going to go through now some of the comments that came. These are written comments in the surveys from parents grouped by themes, because some of these I think are also very instructive. And so one of the themes was that there's not enough information available. And so one of the parents wrote, "I'm bombarded by anti-vaccine information that is detailed and promoted by real doctors and experts in the field. Would like to hear your side, please." So very clearly they didn't feel like they got good scientific information at the session. Another parent said, that they wanted to arrange debates with knowledgeable health professionals to argue for and against vaccine information. And some tried to have a debate with us at the sessions, and we were very clear that we would not do that. In fact, at the large sessions, we did not do group questions because we did it at our very first session and it was not a good choice. And so at the end of the session, we'll answer one-on-one sessions, but we do not want to get into a debate session, but some parents wanted us to. And then another parent said they provide more immunization information and give handouts. And so that's something that now we do. We find though that no one really takes the handouts. Next slide, please. Another theme was that one size does not fit all. And so one parent said, I think you approach this I think if you approach this in less of a there's one right answer approach, you may have more success. I'm not anti-vaccine, but I take issue with your approach of indiscriminate vaccinations. Not every pharmaceutical is one size fits all. Therefore, why do you present vaccinations as such? Next slide, please. There was a theme of fairness, and I put this in here specifically for your group because the first comment, why is immunization not required in other provinces to go to school? And I think that's a very fair comment. Make information sessions non-compulsory and have it online as a webinar. And originally when this legislation was going to be rolled out, we were told as local public health that it was going to be, the sessions were going to be an online webinar. And at the last minute, it was made an in-person session. Next slide, please. And then there was this theme of objectivity of the video. A parent said it was a superficial presentation. No in-depth information was provided with facts to back up claims. Present truth on both sides. Or the topics in the video were one-sided. Next slide, please. So I wanted to share some of those comments with you because it's a very specific group that's coming to these sessions. And I always feel that it's very interesting to read their comments, to understand some of their perspectives. So I thought that qualitative analysis was quite helpful. Now, what ultimately gets asked of us is the in-person education session helpful? Does it work? Does it reduce the exemption rate overall? And overall, our trend in rates before and after the legislation was essentially no decrease for sure. Over the last 10 years in Toronto, we've seen a slow increase in philosophical and religious exemptions and a reduction in medical exemptions. And so in that graph there, you'll see the philosophical and religious exemption rate slowly climb, where in 2006 it was 0.8%, and now last year it was 1.7%. And this trend has been seen across the province as well. Next slide, please. So before I end off, I just want to talk to you about a health services review and appeal board case, because I think it's very interesting and ties in with the education session. And also, as you develop your own legislation in BC, you'll have to think about what mechanisms you use for people who appeal the legislation. Next slide, please. So the Health Services Review and Appeal Board is the appeal process that a parent uses if they want to appeal the suspension order that was for their child to be suspended from the school. And so this is one, it's available online in another health unit. Next slide, please. The appeal was by parents. The parents said they had agreed to participate in the education session, so they had come to the session, but they continued to refuse to sign the statement on the philosophical and religious exemption form. That's the reason for the appeal. And next slide, please. On the form, it states this box, and this is what I was alluding to earlier. The box says risks of not being vaccinated. Immunization programs have resulted in dramatic reductions in VPDs. It gives some example of some of the diseases. With the decision to delay or refuse vaccines, you are accepting responsibility that you are putting your child's health and even life at risk. Be aware that any VPDs can appear at any time in Ontario because all of these diseases still circulate either here or elsewhere in the world. And it goes on to say, delaying or refusing vaccines for your child also puts others at risk of illness, especially children and adults in cancer treatment, those with heart or lung disease or diabetes, newborn babies, and the elderly. Communities depend on high immunization rates to keep vaccine preventable diseases from spreading. When more people are immunized, there's less risk for everyone. If your child is sick and you call or visit a healthcare provider, immediately tell them your child is not fully vaccinated. This may affect what tests they do. Precautions may need to be taken so that a vaccine preventable disease does not spread from your child to other people. Next slide, please. So the parents did not want to sign the form on the basis of their belief that if they do, they would be unnecessarily and unconstitutionally taking on criminal and civil liability if something tragic should happen to their child or another. And now it takes a while to kind of understand what exactly that means, but those were their words as I've taken out of the written appeal board summary. The parents also say that they had objections to signing and swearing to an affidavit under oath to a document that they did not feel as accurate, which in their opinion would constitute perjury. Next slide, please. And finally, they said they objected to signing the form as they do not believe it is necessary to accomplish the purpose of the Act, and that by participating in the education session and notifying the medical officer of health that participating in the varicella vaccination conflicts with their sincerely held convictions based on their conscience, the intent of the Act would be accomplished. So they just did not want to sign the forms. But they did attend the education session. Next slide, please. Now, the ruling from the Health Services Review and Appeal Board said they recognize that the parents have raised their concerns in good faith. However, they ruled that completing the forms as they are and submitting them are reasonable, and the suspension order was upheld. And so I just leave that, leave this case with you, just to have you realize that there are a lot of nuances in the legislation. We in Toronto Public Health have had parents who have refused to come to the education session, and so we've tried to be creative and being able to provide it in different ways. I know that there are other health units that have Mennonite or Amish communities where they don't watch videos, and so they have to present it in paper format and go through it with them. And so there are a lot of variants that kind of need to be considered when a policy is implemented and how it's to be followed through. Next slide, please. So that's the end of my presentation. I did want to leave a bit of time for discussion because I think there's a lot in there that probably makes you think and ask some questions. Before I go there though, next slide please, I just want to be able to acknowledge some of my colleagues here at Toronto Public Health. And the Council of Medical Officers of Health in Ontario has an Immunization School Pupils Act working group that was instrumental in the survey that we used in getting that started. So that's it from me. Monica, if there's time for questions or if there's an ability to have a bit of a discussion, then I would be, that would be great.
Thank you very much, Vanita. And yes, I think we'll take some questions because it'll be harder for you to participate in our panel on the stage at the end of the half an hour. So do you want to take those by Slido?
I have you by Slido.
Okay. Yes, so we've got some for you already, Vanita. So Christine's just coming up.
Hi, Vanita. It's Christine, and we're using an online question and answer format in addition to questions from the audience. So we do have mics if you do have questions from the audience, but just online, I'm going to combine a couple of questions together because they are similar, and it's really about your group education sessions. Because some of the vaccine hesitancy research has shown that this isn't always effective. And they're wondering if you've looked at other ways of delivering education. Are you planning any changes to how you're delivering the education based on the outcomes that you've seen that you showed in this presentation?
Yeah, so the education sessions themselves are mandated and the video itself is mandated. Some health units are only providing them in that one-on-one forum. We're kind of one of the only health units that's using this big format, but we do have sessions that are kind of smaller group, maybe 10 participants and one-on-one sessions. And um, we haven't analyzed our results based on what session they attended, but we did compare some of the survey results with some other health units that have had the sessions one-on-one and did not find that there was much of a difference in being able to change people's minds, for example. But the engagement that you have is really you're putting them in a room, they're watching the video, and afterwards you're asking them if they have questions. And so it's not quite a clinical environment.
Okay, thanks. Another question is about Ontario's process. And the question is, for how long is the exemption applicable? Is it just for one school year or until graduation?
So the suspension order is for 20 days. You can reissue a suspension order at the end of 20 days. Each year we will assess the students because as students age up, they may become due for vaccinations. But you know, if you meet the requirements in 1 year, you got your 1 MMR, the next year when we assess you, if you haven't got your second MMR, you could get another suspension order. So you could get repeated suspensions through the years.
And do both parents have to sign the form or only one?
It only requires one parent, and we have had situations of custody concerns. One parent is opposed to vaccinations, one parent is for vaccinations. We don't get involved in the middle of those disputes, and those can be challenging though.
How did you engage with vaccine hesitant parents when developing your video or education session?
The video was developed provincially, so locally we didn't. They did have focus groups that they used. They did have a whole process before they developed the video, and there have been some updates to the video. For example, in the first round, one of the complaints we got about the video was who is funding this video. I'm sure it's Big Pharma that's funding it, and so they made an adjustment where they put this video was solely funded and produced by the Ministry of Health, for example. So. But there are always things though that that need to be tweaked a bit. In the first round of the video, there was an infant being fed with a bottle, and so that was quickly alerted to, and now that's been removed, for example. So, but whether there's ongoing focus groups to try and assess the video, I'm not sure about that.
This is a cost-benefit question. So, do you think that the cost of putting on the education, developing the education, has been worthwhile given the small amount of change in actual uptake of immunization?
Yeah, so this is the question that comes up a lot, especially as local public health departments are trying to assess their resources and what they put their resources into. I did not mention this, and I should have mentioned this, that the goal of the education sessions from the Ministry of Health is actually to obtain informed consent. And so the purpose of it is so that the parents are informed on the risks of not vaccinating their child. And the intent of the education session is not to change their mind. And so from that perspective, the goal is being reached. I would assume, but you know, informed consent is a difficult thing to be able to evaluate. What I do leave you with, though, and it's probably not a great intervention to change people's minds. On the other hand, you know, 81% said that they would continue to get an exemption. 19% either said no or they were unsure. And so I think there's more that we could do to try and understand if those 19% then go on to get vaccinated, well then actually maybe it is effective. So we just don't know that right now.
Okay, thank you. Just a question too about older teens that you would classify as mature minors who are in school. That's a terminology that we use here in BC. So those would be teenagers who are able to make their own healthcare decisions. Do you have a separate process for them? Do you address them, or is it all done through parents?
So it's a really excellent point, because Ontario has the Healthcare Consent Act, which actually has no age for consent. And typically we use about 14 as the cutoff once you're in high school, that you can, as long as you can, the student can give informed consent, they can choose to get vaccinated. The interesting thing though is that in the Immunization School Pupils Act, the philosophical and religious exemption form can only be completed by a parent, regardless of the age of the student. And so it puts us in this conundrum where we've recently had a parent who decided they did not want their high school child to get the meningococcal vaccination and filled out a philosophical and religious exemption form, when on the other hand, if that high school student chose to get the vaccine, they could just come to one of our clinics, sign the consent form and get it. But that, letting that student know about their ability to do that is not part of this process, and it is a disconnect between the two pieces of legislation.
Okay, thank you. And I think we have time for just one more, and that is, and this is probably really relevant for us in BC. Can you comment on the proportion of records recovered following the issuance of letters or an order prior to having the parents attend an education session?
Yeah, so what we know that each letter, the system does work. It's very labor intensive, but usually initially we have maybe about, say, maybe 60 or 70% of the students who are already up to date when we do the assessments. Then after the first letter, another 10% get updated. After the second letter, another 20% get updated. And after the third letter, another 30, almost all kids. The actual number of students that actually go to the first day of suspension is actually quite small. And usually the suspensions are resolved within 1 to 3 days because we get the information or whatnot.
Thank you.
Thank you very much, Vanita, and thank you for joining us remotely. And
thank you for having me, and kudos to you for having this technology available, and I really appreciate it. And again, my apologies for not being there in person.
Thanks very much. And I think that our group clapping.
Thank you.